Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Australia is set to practically eradicate cervical cancer following the completion of a 10-year review of giving schoolgirls aged 12 or 13 a free HPV vaccine. Since 2007, the level of 18 to 24-year-old women with HPV has sharply fallen from 22.7 to 1.5%. The International Papillomavirus Society announced in March that Australia could become the first country to completely eliminate cases of cervical cancer. Susan Garland from the Royal Women's Hospital and the University of Melbourne advises on World Health Organization and global policymakers on cervical cancer prevention and screening. Professor Garland has stated over the next 30 to 40 years, rates of cervical cancer will drop from around the current 1,000 cases a year in Australia to just a handful.
Question 26. Now read the question.
Hello, my name is Ian Burgess. I'm CEO of the Medical Technology Association of Australia. Our members are manufacturers and suppliers of medical technology that's used in the treatment, diagnosis and management of disease and disability. They range from small Australian companies that may have turnover of less than $1 million through to large multinational companies. And around 80% of our members are SMEs. The technology can include wound treatments, syringes, hospital consumables, through to high-tech hospital equipment, and the high-tech implantable devices such as pacemakers, defibrillators, neuromodulators, hip replacements, knee replacements, and other orthopaedic implants.
Question 27. Now read the question.
Hi, I just wanted to share my point of view on hysterectomies. I've been battling endo for 10 years now, and I had a hysterectomy when I was 17 years old. And I'm a fairly recent patient of Dr. Seskin, and if I met him earlier on, that probably would not have happened. So my main mission is just to advocate for the future girls who are undergoing these, in some cases, unnecessary hysterectomies, because it didn't help in my case. It actually came back years later worse than ever, and I had to take a leave from law school, but I'm doing great now after a year post-op. But yeah, I just want to advocate that for unnecessary hysterectomies, there has to be a change for that, and the correct information needs to be out there. So, thanks.
We just have a final comment on this topic from Dr. Ridge.
It should be, for you out there, hysterectomy is never indicated for endometriosis. Endometriosis is not cancer. And I think Farah will tell you, cancer requires hysterectomy. Sometimes it's necessary to look and look and look and look till you find a surgeon who won't do the hysterectomy. And they do exist.
Question 28. Now read the question.
The clients that I tend to see that are coming with addiction concerns typically present with other mental health concerns as well. That can range from anxiety, depression, or stress within the workplace. Quite often people are falling, I suppose, victim to the culture of the industry that they're in, or perhaps this could stem from, a historical concern around substance abuse within their family or their environment. But yeah, predominantly the mental health concerns that I see are definitely related to stress and anxiety or depression. The concern with diagnosing these mental health concerns when there are substances involved in the person's presentation is you're not sure whether you're seeing an actual mental health concern or whether it is as a result of the either the come down or the intoxication of a substance. So it can be really tricky to do for medical professionals or psychiatrists to diagnose off one initial session. So it is really important to have a really broad history for the client, and understanding that rapport is really important as well. The more rapport you have, the more likely it is that someone's going to tell you the truth if they're using something. So it is really important to kind of have that time and space to get to know the person over a few sessions.
Question 29. Now read the question.
I wanted to show you the traditional way we would demonstrate a patient's MRI to them, or to, for instance, a medical student. And this has now become a very critical component of a consultation with a patient, taking them through their MRI data, because a lot of the disease activity in MS and other brain diseases is subclinical. In other words, it's not overt. The patient may not be aware of what's going on. You do an MRI scan, it provides a lot more information, so it's very important to convey that to the patient. And the way we would normally do it is show a two-dimensional representation of the brain, which is divided into slices, I'll start at the bottom of the brain down here, and then as I scroll up, you can see the slices going up the patient's head, eyes being at the front, nose, back of the head, ears on either side. Right is left, left is right. And in this case, this is in fact an example of multiple sclerosis, and you can see the typical periventricular, around the ventricles as they're called, white matter lesions, and these are patches of inflammation and scarring, or sclerosis, which gives the disease its name. But without domain knowledge, it's very hard for either a student or a patient to look at this sort of two-dimensional representation and come to grips with what the disease is doing, what parts of the brain the disease is affecting. And so we do this, and I do this on a daily basis with patients, but it is very difficult, and the patients clearly, when they're looking at this for the first time, are quite perplexed by it.
Question 30. Now read the question.
You know, in my practice, I never ordered MRIs. And I was just talking to somebody back there, and everybody seemingly has an MRI. Now, MRI is valuable to diagnose adenomyosis, which is endometriosis inside the muscle of the uterus. But for endometriosis outside of those areas, why is this all of a sudden MRIs ordered that cost the patient quite a lot of money?
I agree with you. MRI is very expensive, and I do believe that it's not necessarily the standard imaging, because as we all know, endometriosis, it's not detectable by imaging unless it's a mass form. So if it's an endometrioma, you can probably get that by ultrasound. I would say probably the one area maybe would be, of course you do your rectovaginal exam, and if you feel that rectovaginal nodule, if you want to know where the relationship it has to the bowel and the size, location, etc., I think that would be one area of use.
That is the end of Part B. Now look at Part C.